My name is Boris Prilutsky. I'm practicing medical and sports massage for 50 years. It's a science-based, like we like lately to say, evidence-based methodology of treatment. I have developed, maybe life-saving for many, protocol. I know this for many years since I've worked with Olympians. Yeah, the chronic stress side effects and related illnesses not. Pandemic, it's over. But the side effects, it's continued, the echoing. You know what? 100 million Americans were infected by COVID-19 virus. And this is National Institute of Health and other kind of solid medical establishments, they predicting that every one of them, and 100 million Americans, think about numbers, have high chance to develop dementia because the low-grade inflammatory condition within the brain continue destroying. And this is kind of condition that, yes, it's a precondition for development of degenerative brain diseases. Yeah, my treatment addressing all this, if you want, and especially talking to massage therapists, physical therapists, chiropractors, it's a very, very necessary to know nowadays webinar. Please visit my website, medicalmassage-edu.com. Click on webinar and you will be able to read everything what I am teaching, and this is like a syllabus. Looking forward to see you in my classes. Also, you will find a lot of articles on this subject. When you will visit my website, click on blogs. Thank you very much.
Here is an important clarification. Medical massage within this model refers strictly to a systemized combination of massage modalities performed entirely within the licensed scope of massage therapy practice and regulated in the same manner as all professional massage services. Regarding hands-on performance, we have often observed therapist techniques during Swedish massage and other forms of massage. We believe that, because of the strategic sequencing utilized in specific medical massage protocols, medical massage may require significantly less physical effort than many traditional massage approaches. Like many of his colleagues, Boris was trained in the classical academic model, memorizing anatomy, studying physiology and pathophysiology, and preparing for examinations. Fortunately, alongside this theoretical foundation, they were also trained in a wide range of hands-on massage protocols designed for specific disorders. Importantly, the physiological effects of massage on the human body formed the foundation of this practical training. We say, fortunately, because academic education alone often dominates, sometimes fostering an overly theoretical approach disconnected from clinical reality. After graduation, Boris's mentors played a crucial role in shaping his clinical thinking. Like many practitioners, he navigated the tension between academic standards and real-world clinical outcomes. Today, he aims to serve as that mentor. The goal of this article is to present ingeniously simple medical massage, particularly in the context of long COVID and chronic stress-related disorders, which have become a major focus of his practice over the past 5 years. The 5 miracles of medical massage. To understand the power of this approach, we must revisit the fundamental principles of massage therapy. 1. The first miracle: electrical activity. Through manual contact, we generate significant electrical activity in the body. This triggers action potentials, stimulates the central nervous system, and initiates systemic physiological responses. Few therapeutic methods, including pharmacological interventions, can stimulate the organism as comprehensively and naturally. The second miracle: the power of technique. Technique determines outcome. By applying different approaches, we guide the body towards specific responses. Inhibitory techniques increase pain thresholds via the gate control mechanism. Targeted stimulation promotes acetylcholine release. Mechanical input supports mitochondrial biogenesis. Each condition requires specific protocols developed through scientific and clinical research. The third miracle: autonomic balance. Perhaps the most profound effect of medical massage is its ability to regulate the autonomic nervous system, ANS. Restoring balance between sympathetic and parasympathetic activity is essential for healing. The fourth miracle: integration of energy work. Beyond physiology, massage can incorporate elements of energy work. Scientific understanding increasingly supports its role, not only in enhancing outcomes, but also in protecting practitioner health. The fifth miracle: the power of knowledge and adaptation. Massage science allows cross-application of techniques. For example, pre-event sports massage can improve blood flow velocity and stimulate mitochondrial activity, benefits that extend beyond athletics into clinical populations. The post-COVID era, a global stress model. During the COVID-19 pandemic, populations were exposed to prolonged psychosocial stress. Large-scale data confirm a persistent rise in stress-related disorders. Most medical literature agrees. Chronic activation of the hypothalamic pituitary adrenal (HPA) axis and autonomic nervous system contributes to neuroinflammation, immune dysregulation, sleep disturbance, cognitive dysfunction, and widespread somatic symptoms. Acute versus chronic stress, a critical distinction. Acute stress. Imagine encountering an aggressive dog. Neck, upper back, and diaphragm muscles contract. Heart rate and blood pressure rise. Adrenaline and cortisol surge. Breathing accelerates. Once the threat is removed, the body returns to baseline. This is adaptive and reversible. Chronic stress. Chronic stress is fundamentally different. It represents prolonged activation of the same response over weeks, months, or years. The COVID-19 pandemic created exactly this condition: sustained uncertainty, isolation, and perceived threat. Neuroendocrine and autonomic dysregulation, HPA axis dysfunction. With chronic activation, feedback mechanisms fail. Under normal conditions, the HPA axis operates through a negative feedback loop. Cortisol released from the adrenal glands signals the hypothalamus and pituitary gland to reduce further hormone production. In chronic stress, this feedback system becomes impaired. Receptors become less sensitive, glucocorticoid resistance, and the brain no longer properly shuts off the stress response. As a result, cortisol levels become dysregulated, either persistently elevated or abnormally fluctuating. Cortisol signaling becomes disorganized. Vascular, immune, and metabolic systems are affected. Autonomic nervous system dysfunction. Sympathetic activity becomes unstable. Parasympathetic, vagal, tone becomes dysregulated. Baroreflex sensitivity declines. Baroreflex sensitivity refers to the body's ability to rapidly regulate blood pressure through reflexive adjustments in heart rate and vascular tone. Specialized receptors, baroreceptors, in the carotid arteries and aortic arch detect changes in blood pressure and send signals to the brainstem, which then adjusts autonomic output. In chronic stress, this system becomes less responsive. The result is impaired short-term blood pressure control, reduced adaptability of cardiovascular function, and further destabilization of autonomic balance. The pathophysiological cascade. Chronic stress leads to a predictable cascade. Persistent cervical and upper thoracic muscle tension. Impaired venous and lymphatic drainage. Obstructed cerebrospinal fluid, CSF, flow. Increased intracranial pressure. Reduced cerebral perfusion. Neuroinflammation. Mechanical tension in the neck and diaphragm directly interferes with fluid dynamics. The result is impaired removal of metabolic waste and reduced delivery of oxygen and glucose to the brain. Autonomic dysregulation as a biomarker. A critical question must be asked. Can the brain function normally under these conditions? The answer is no. Patients develop cognitive impairment, sleep disturbances, emotional instability, memory deficits. In our clinical view, autonomic dysregulation is a key biomarker of brain dysfunction. Restoration of autonomic balance reflects neurological recovery. The scale of the problem. 75 to 90% of primary care visits are stress-related. 20 million Americans live with long COVID. Over 100 million have had COVID-19, with increased cognitive risk. This is a massive clinical phenomenon. Clinical discovery: long COVID. Approximately 6 months ago, a neurologist referred a patient to our practice after a full neurological workup. She presented with anxiety and depression, TMJ dysfunction, brain fog, headaches and pressure, sleep disturbances. After 8 treatments, she reported significant improvement and revealed a 3-year history of long COVID. This case prompted further investigation. We contacted 24 neurologists and began treating long COVID patients using the chronic stress protocol. Across 20 patients, each received approximately 15 sessions. Improvements were consistent. Symptoms decreased significantly. Assessment: dermographism as a marker. Our evaluation begins with a dermographism test. Dermographism, skin writing, is a simple neurovascular reflex test in which light mechanical stimulation of the skin produces a visible response, typically a red or raised line. This reaction reflects the balance of autonomic regulation at the level of the microcirculation and mast cell activity. In a balanced autonomic state, the response is mild and transient. In autonomic dysregulation, the response is exaggerated, prolonged, or irregular. In our clinical practice, all patients demonstrated autonomic irregularity at baseline. We use this test not only for initial assessment, but also as a dynamic marker of physiological change throughout treatment. Reframing long COVID. Early literature emphasized microvascular damage, particularly in the lungs. However, this alone does not explain neurological symptoms. We concluded that chronic stress is a major driver of long COVID pathology. Microvascular and mitochondrial mechanisms. Chronic stress leads to reduced nitric oxide production, impaired vasodilation, decreased acetylcholine signaling, mitochondrial dysfunction, increased oxidative stress. The result: capillary constriction, reduced oxygen delivery, impaired tissue repair, endothelial inflammation. This process is functional and, importantly, reversible. Why patients don't improve. Many skilled practitioners face a frustrating reality. Correct techniques, sound reasoning, no clinical improvement. The issue is often not technique, but missing the underlying mechanism. A shift in clinical reality. In recent years, we began seeing patients with combined symptoms: headaches, cognitive decline, TMJ dysfunction, sleep disorders, dizziness. These were not typical cases. The common denominator was chronic stress exposure during the pandemic. Lessons from elite athletes. Our experience with Olympic athletes provided critical insight. Under extreme stress, athletes developed burnout, emotional exhaustion, cognitive decline, sleep disruption, autonomic irregularity. The similarity to post-COVID patients was striking. Beyond technique. Over decades, one principle has become clear. Technique alone does not determine outcomes. Understanding the underlying physiology is essential. Ingeniously simple solution. In acute stress, the first physiological event is immediate muscular tension in the neck, upper back, and diaphragm, obstructing venous outflow. With chronic stress, hormonal overdrive triggers neuroinflammation. Edema develops. CSF volume increases. Intracranial pressure rises. Cerebral perfusion decreases. The brain requires more oxygen and glucose, but receives less. The clinical insight. The entire pathological cascade begins with myofascial tension. To reduce intracranial pressure, restore cerebral perfusion, improve brain function, we must first eliminate pathological muscle tension. The therapeutic outcome. By addressing cervical and thoracic tension, venous drainage improves, CSF flow normalizes, intracranial pressure decreases, brain perfusion increases, and most importantly, healing begins, often from the very first treatment.